It's 5 needles that you put in each ear, and it can decrease feelings of anxiety and depression and improve the ability to cope. It increases mental clarity and appropriate level of alertness. It can help with appetite and improve sleep.
Enchanted Sky Media.
From the Federal Resources Studio, this is Code 3, the Firefighters Podcast, hosted by award-winning journalist Scott Orr. Code 3 features interviews with leading members of the fire service, discussing firefighting strategy, tactics, and other topics you need to know more about. Now, here's Scott.
That's right, and I will not let Parkinson stop me. Thank you for joining me again here on Code 3. This is the show for and about firefighters. We're informing and entertaining members of the fire service, just like you, from coast to coast. What do you know about acupuncture? Yeah, it involves needles. But do you know what it can do for you? Here's one benefit I just learned. It can be used to treat PTSD. It's also helped relieve depression, chronic fatigue, joint pain, low back pain, and a lot of others. Plus, of course, it works without drugs. That's why my guest today says it's perfect for firefighters. Dr. Nikki Kelly is a former firefighter. She was an engineer EMT for the Tavares, Florida Fire Department for 6 years, and she was awarded Firefighter of the Year in 2010. She discovered what acupuncture could do 11 years ago after she sustained a back injury during a training exercise. Now she's a board-certified licensed acupuncturist and herbalist who specializes in treating first responders. And Nikki Kelly joins me now. Welcome to Code 3.
Hi, Scott. Thanks for having me.
Let's start with the basics. What is acupuncture and how does it work?
Okay, well, acupuncture has been around for over 4,000 years. It's been a form of effective medical treatment that has evolved into a complex holistic healthcare system. So acupuncture needling promotes homeostasis and self-healing. Your body already knows how to heal itself. The acupuncture needles just help to bring your body back into balance. So in short, acupuncture stimulates the body's own resources to heal itself. Western science has shown acupuncture can suppress an overactive sympathetic nervous system by stimulating the release of oxytocin, which will disengage the body's fight or flight response. Acupuncture is also known as kind of like an internal medicine because it uses your body's internal resources, whereas Western medicine is considered an exterior medicine because you are using exterior resources like medicine to help get you back to a state of well-being. So acupuncture also increases the parasympathetic nervous system and activates the body's own internal healing ability, like I just mentioned. And acupuncture creates micro-traumas that stimulate the body's ability to spontaneously heal injuries in the tissue through the nervous, immune, and endocrine system activation. And as the body heals the micro-traumas induced by acupuncture, it also heals any surrounding tissue damage left over from old injuries.
There is definitely some skepticism among fans of Western medicine about this, and I'm curious, did you feel that way when you first heard about it?
Actually, I did not, because I had used it to help me when I injured my back on duty, because I didn't want to take the pain meds, and my dad and stepmom had been using Chinese medicine for years and years. So I lived in Orlando at the time, and I drove to Cocoa and went to my dad's acupuncturist, and she helped relieve my back pain within just a couple sessions. And I also went to a chiropractor on my own that helped. The department sent me to a physical therapist, which actually made the pain worse. But I could see where the skepticism is because it's not very widely known in the United States.
Well, it also has a feeling of too good to be true. Someone inserts some needles in some special spots and everything is fine.
Right. Yeah, I can see that. Or some people just completely disregard it. And I don't know if I was actually surprised when I got out of school and started, going out there and meeting people and, trying to network and tell them about acupuncture. A lot of people had no idea about it. And I mean, this was in California, where
you would expect them to know about it.
Yeah, but I was really surprised that a lot of people had no idea what it did and how it could help.
How fast does it work?
Well, it depends on the person. Every body is different. Some people could notice like pain reduction, say if they came in with back pain at a 7 out of 10. Some people could notice it a 0 out of 10 when they leave. Some people may notice just a small reduction. Some people may not notice any change at all. It depends on the person. That's why it's hard to gauge it after just one treatment, because the treatments build on each other. So I'll have people come in and they'll try it once, and then they'll schedule their next appointment, and then they'll call me or just not show up for their next appointment, and they'll tell me, oh, I didn't get any relief, or I felt no effect, and so they don't want to come back.
Now, in terms of physical injuries or physical pain, does acupuncture actually repair the problem, or is it about relieving the symptoms?
It's more about relieving the symptoms. If there's actual structural damage, acupuncture can help with the pain management, but it can't actually fix the structural damage. It can help with blood flow and circulation to the area. But I mean, of course, if you have like a broken bone, it's not going to heal the bone itself.
Right. I'll be back with more right after this.
When that call comes in and you rush to head out, the last thing you're thinking about is your safety. But your safety is all Federal Resources thinks about. At Federal Resources, we work to make sure that every responder is equipped, trained, and ready to come home safely. You look out for everyone else. Let us look out for you. Learn more at federalresources.com.
I am assuming here, because I've heard that it can be used to treat PTSD, that it actually changes that. It's not just covering up the symptoms of it.
That's correct. There is a specific protocol that I use. It's called NADA, N-A-D-A. It's the National Acupuncture Detoxification Association. And it's 5 needles that you put in each ear. And it actually can reset the sympathetic nervous system to create a relaxation effect. It can decrease feelings of anxiety and depression and improve the ability to cope. It increases mental clarity and appropriate level of alertness. It can help with appetite and improve sleep. When I was in school in San Diego doing my clinicals, we had to do several off-site clinical shifts, and I chose to do the one at the veterans off-site, and it was all free for veterans. It was once a week. We had 20 chairs set up in a circle around the room. This is called community-style acupuncture. And so the treatment wasn't as invasive as coming to a clinic where you can lay on a table. The patients were sitting in a chair, and we always put the needles in their ears with this the NADA protocol. And then if they had some other issues going on, we would put, in their hands or feet, because you could treat like back pain using distal points on the feet. And I would have people coming back the next week saying, wow, I felt great after the session. When I got home, I had my family notice that I wasn't as angry as I had been in the past. I was able to go out and to participate in a social activity without feeling as anxious or, being on high alert as I had been in the past. So, that was pretty good. And people came like from miles and miles, like really far away to experience the free benefits of acupuncture at this clinic. It was pretty amazing.
Oh, it sounds like you're saying here that people suffering from PTSD can actually see very rapid results.
The people I treated did. And like I mentioned earlier, it depends. I did have a patient, he started having immediate results.
So once we use acupuncture and we get those results, how long does it last? Or do you have to come back for repeated treatments or what?
At first, when I first see someone, I like them to come back 1 to 2 times a week for the first few weeks. And I just have them, kind of check in with themselves and see how they feel when they leave, and then see how long it takes for symptoms to start coming back. It can decrease severity, frequency, and intensity, but I just have them pay attention to what's going on with themselves and see how long the effects last. And, I like them to come back 1 to 2 times, first 2 or 3 weeks, and then we can start spacing it out. The goal is eventually to have them not come back. Some people, and you can come back like maybe once a month or once every other month just for maintenance.
How much of this is covered by typical health insurance?
Well, it depends on what you're coming in for. Most insurances, if they do cover it, will only cover it for pain, or they will also cover it for nausea due to the effects of cancer treatment. They don't cover it for anxiety or sleep issues or anything like that.
All right. You say acupuncture can be preventative. How is that? What does it prevent?
Okay, so if you've got an imbalance in your system, you'll start noticing things that aren't right, like you've got bad sleep or digestive trouble. So by addressing these early warning symptoms, it can work where it will prevent more serious medical conditions from happening that can come as a result of some of these early warning signs.
Tell me a little bit about first response acupuncture.
First Response Acupuncture is a nonprofit organization for firefighters and other first responders. It's in Rockledge, Florida. I only do it part-time right now because I work full-time as an emergency vehicle dispatcher in Brevard County. My hopes one day is to have the services free to first responders because I think it is a valuable adjunct therapy that can really help them. And I know how we don't like to part with our money, so.
Yep, especially when you're not making a whole lot of it.
Yes.
All right, Dr. Nikki Kelly, thank you for talking with us today on Code 3.
It was my pleasure, Scott. Thank you.
And we put some more information about first response acupuncture on our website at code3podcast.com/acupuncture. Check it out. Now, here comes your trivia question. What is the leading cause of residential fires these days? I'll have the answer right after this.
Ever notice that Scott always tells you that you can get a guest's book at our website, code3podcast.com? That's because we have links to order their books from Amazon on the episode's show notes pages. It makes it easy for you to get the books, and it helps support Code 3. When you buy Amazon through our website, we get a small cut too, and it doesn't cost you any more to order through us. Plus, there are other firefighter-related products there too. Take a look at code3podcast.com.
Here's the trivia answer. Cooking and cooking equipment are the most common cause of residential fires. All right, that's it. That's all for this edition of Code 3. Love to hear what you think of the show. Just email me, Scott at code3podcast.com. Thank you for listening. I'll be back next time with more. Hope you'll join me. I'm Scott Orr, and until then, I'll see you later.
Code 3 is made possible through the generous support of Federal Resources. Visit them at federalresources.com. This show is a production of Enchanted Sky Media. To contact us, get more information on today's show, or to subscribe to the podcast, go to code3podcast.com.